All right. This patient was referred to me for endodontic treatment of tooth number 18. Another reason why multiple angulation PAs are important. Patient says 2 weeks ago her face was all swollen up. She went and saw her dentist, and her dentist told her that her tooth number 18, which is the lower left second molar, was abscessed and needed a root canal. Patient was put on antibiotics and referred to us. Today, patient says she took the antibiotics and swelling went away. So she's here for root canal of tooth number 18. Multiple angulation PAs. Again, another reason why you should take multiple angulation PAs. Another reason that you should not trust another clinician's diagnosis. Okay? Don't trust another clinician's diagnosis. Do your own homework. Do your own diagnosis. Okay? So take a look here. As I always tell you, we never ever rely on one angulation PA to make a diagnosis. So as the patient is telling me this, I'm looking at the x-ray and I'm like, well, if you had a facial swelling, I'm thinking to myself, if she had a facial swelling, wouldn't there be a periapical relucency? I mean, it could be a acute apical abscess, but very likely not. If the patient has a facial swelling, very likely there is a periapical relucency. So you need to look for that. Very rarely you find a facial swelling with no periapical relucency, and that's called an acute apical abscess. Okay, let's look at another angulation PA. Okay, again, look, it's fine. Number 18 is fine. Number 19 is fine. That's normal bone anatomy there. So that's not a periapical relucency. All right, let's look at the next PA. Okay, I'm looking at this PA, and I'm like, okay, fine. What is going on here? That's tooth number 20. What's going on here? So I told my assistant, I said, go ahead and take a PA of this. Usually my assistants are very good. They read x-rays better than most clinicians. But I think today she was kind of off and she missed this. So I said, okay, take a couple of more PAs of tooth number 20. And she did. And look at this. Lo and behold. Tooth number 18 was never an issue, so her dentist misdiagnosed. But of course, as I said, we never ever rely on another dentist, another clinician's diagnosis to recommend treatment. We do our own. All right, so it was not tooth number 18. It was tooth number 20. Look at that huge periapical relucency there. And also look at that inflammatory resorption going on right there. All right, so patient couldn't even believe it because she was sold by the dentist that tooth number 18 was the abscess tooth. So I did some patient education, and that's very important also, educating your patients, and talk to her about the infection here, the resorption, inflammatory resorption there, went over her options. We can try the root canal, no promise or guarantees, only time will tell. Root canal could fail, then you would have to pull the tooth. Not only because of the infection, but also because of the inflammatory resorption. Or the other option is to go ahead and extract the tooth. And patient said she wanted to try to see if tooth could be saved.